Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You're watching Conversations with Jennylyn, and as I continue my COVID-19 World Series of interviews, I was going to be very sad if I could not include Belgium. So today we are very blessed because we have Dr. Ivar van Heijningen joining us from Belgium, and I can't wait to share all that's been happening in Belgium with him. Welcome to Conversations with Jennylyn, Ivar.
Well, thank you, Jennylyn. It's very kind of you to ask me to join you, and I'm very happy to represent Europe and in particular Belgium to give some oversight from our side of the ocean. So tell me, what can I do for you?
Well, first of all, I hope I did not ruin your name. I gave it my best shot.
Well, Van Heijningen is a difficult name. Actually, I'm Dutch, and Heijningen is a small town just a little bit to the north of where I am now in Belgium. So it's and Van means from. So my ancestors probably came from that little town.
Aha, I thought you had a Dutch name. I was going to ask you that. So at least I wasn't too far off. Anyway, you are a plastic surgeon and you practice in Belgium, am I correct?
Correct.
How has your business been affected by COVID-19, if it has?
Well, I think for every plastic surgeon, and especially the plastic surgeons who are a little bit more in the aesthetic business, all of us have been severely affected. We have to be realistic. When the people are dying in hospitals and are in ICU units, then aesthetic plastic surgery is not the first priority. So a lot of our colleagues decided immediately when this pandemic hit us to close down their practices and to even donate their respirators if necessary to the hospitals and to put stuff on hold and do what everybody had to do, and that is sit at home in quarantine. So that's what I did for 7-8 weeks.
You did?
Yeah.
My goodness. But what about cases when someone is involved, like in a car accident, and they need repairs? Were those cases put on hold as well?
No.
Okay.
So the only things that I did get out of my home was when I had to go to the emergency room to do stuff like that.
Okay. Did you get called a lot to do that?
Not particularly much. I think 4 or 5 times. But I'm living on the coast area of Belgium, and my hospital is not a big university hospital, so it's a smaller hospital. So fortunately, we have less caseload in that sense.
How was the country of Belgium affected by this virus? Would you say moderately, severely? What do you think, based on what you've heard and know?
It's an interesting question, because we showed up on one of the slides of President Trump as one of the countries being hit worst. But I think, figures and numbers, there you can manipulate them easily, and it's all up to interpretation. I think we've just been affected as most countries. I think we are closing in on the 10,000 deaths right now, and we have like 60,000 confirmed cases. So we have been hit severely. But if you look at those numbers, then it sounds like, whoa, you are in the top 5 of countries worldwide. But I think 60% or 65% of those deaths have been in nursing homes and have been not happening in the hospitals. And I know that in a lot of countries, when they talk about COVID deaths, they only count the ones that happened in the countries. So if you ask people for numbers, what do they include? If someone is terminal ill and has cancer and then gets a COVID and dies, what did he die of? Did he die of the COVID, or did he die of his terminal cancer and maybe just a little bit earlier? So those figures not always easy to interpret. So I would consider looking at our numbers and looking at the worldwide numbers. I would consider Belgium to be affected just as hard as the majority of the countries worldwide.
Well, I agree with you. There is really no way to measure these numbers. I was having this conversation yesterday with someone about even taking the test. You can test today and you can test negative, and you can go to the grocery store, and by the time you get home that night, you've been exposed. So what does the test mean? You know? So I agree with you. Now, do you feel that your country didn't quarantine in time? Because the common thread I'm seeing as I've been doing these interviews, and I've done over 30 countries, the countries that they reported going into quarantine early in the game, they were able to really control the virus. They had less contaminations, in some cases, no deaths. Do you think that your country didn't quarantine early enough? How do you feel about that?
Well, you mentioned some uncertainty with the tests, and I think that is basically the word that we have to put very big and focus on: uncertainty. Nobody would ever know what would have happened if we would have been earlier or whether we would have been later. There's so much uncertainty about this virus. There are people who have a lot of immune globulins in their blood, but who were almost not ill, and there's people who've been very seriously ill who have very not many immune globulins in their blood. So the testing, what do you test? Do you test for the virus? Do you test for the immune globulins? If you have them, will you not be able to get the disease, or will you? We don't know. So there's a lot of things that we don't know yet. So that makes it interpreting makes it really very difficult.
And some people have some very convincing arguments in terms of the origin of this virus. Do you know anything? It's so controversial. I'm almost afraid to go there when I do an interview. But yesterday I had a very compelling discussion with someone who is convinced, and this is a very learned, informed person, that this virus was created by some people that you and I know and that are very famous, that I'm not going to name. But what is your feeling on that?
Well, I think I can guess what you're talking about, and it has something to do with computers. But but well, there will always be all sorts of complot theories, and complots exist. Is it possible? Well, if you look at the case they make, it seems like it is very possible. But you know, there's a lot of very good detective writers who write books that also have plots that are very plausible. I'm not someone. I'm pretty down to earth. I don't really believe in complots, and I want to believe in the good of humanity and the good of people, and I don't think that people would set something up like that to harm us all. So I try to look at those theories as well. Okay, is that an option? Well, I think it's highly unlikely. I mean, we know that these viruses, these coronaviruses, have been around. If you just look at history, if you look at the plague, if you look at the Spanish flu, I mean, this is not something new.
I agree with you. It's funny how when people believe in something, how they can make their arguments so compelling. That, you know, the saying, the good old saying, if you don't stand for something, you'll fall for everything. Sometimes I find myself wondering, are they really onto something? But the bottom line is the virus is here, and we have to deal with it, and we have to stop it. We have to protect and save lives. I interviewed a doctor in South Africa a couple of weeks ago and was very surprised to discover they've lost quite a few babies to this virus. Do you know of any children who've lost their lives to it in your country?
I think there was a 13-year-old. I think in the UK there was a baby. Um, it's like, you know, when I talk to patients about medicine, I always explain to them that it's what we call a Gauss curve. Huh? You have the very small people and the very big. You have the very thin and the very fat. And like with diseases, there is not a very big likelihood that someone very young will die from that. But if you have millions of people or hundreds of thousands of people suffering from a disease, well, there will be some exceptions where some very young people get hit. And because that touches us emotionally, it gets into the news and we focus on it. And this entire virus thing gives me a very double feeling. We have to take it really seriously. On the other hand, we have to go on and live our lives and try to just take measures, be sensible about it, use some hand alcohol. When I do my consultations, I put my mask on, and if I really get close to patients, I even put my face shield on to protect them, to protect myself. Those are the sensible things to do. A virus can only hit you if there is a certain number of virus particles that are excreted from the person, if you are really close to them, and how long you stay close to them. So if you keep your distance, if you don't stay very long with them, and you consider everybody as potentially infected, then we're doing a great job.
I agree with you. How do you feel about the belief that the virus lives on the handles of shopping carts and, you know, public places that you interact with other people?
Well, it is probably a fact. I mean, if I am someone with COVID-19 and I cough in my hands and then I grab a handle, then there's a very high likelihood that some of these virus particles will be on the handle. So what? Now you come in, you take my card and you touch my particles. You have your particles on your hands. Well, if you are aware that you can get them from touching a handle, and after getting out of the shop, you take your alcohol and you put some alcohol on your hands and you rub your hands, well, that they are. No need to really get worried about the fact. Most likely, most of us will get in touch with some virus particles. But is it 100? Is it 1,000? Is it 1,000,000? It's like with every infection, you only really get infected when it's a lot and when it's close by. So if you have a very infectious a person coughing you in your face in a room that's not well ventilated, well, you're in trouble. But if there are some virus particles on a door handle, I think no need to worry about that. Even if you don't disinfect your hands, probably your immune system can kill those particles and those virus particles.
Yes, there are a lot of people, I think, that are very scared. They should have a conversation with you.
Well, I hope that I can contribute a little bit.
Yeah, because I think it's as simple as that. I've seen a lot of paranoia, and I've actually been in the store sometimes and I forget. You know, I forget what this whole, because I'm not afraid. Like you say, I do what I know I need to do. I'm vigilant to protect myself. And I think it's as simple as doing that. We don't need to become paranoid and lose sleep.
No.
But some people are, and I guess I understand, you know, some of them are older and this is why they're so fearful. Is your country still in quarantine, or have they released everyone back out and opened up businesses again?
Um, Most businesses have come out of quarantine. It's only last week that restaurants are allowed to start again, keeping social distancing. So it's been slowly restarting. I think I started around 12th of May or so. So we've been open for a month now, and people are just resuming coming in for their Botox, for their fillers. All my operations have rescheduled, so um, I lost the 2 months that I was at home, but other than that, life goes on, and that's how I try to deal with it.
In most countries, they offer distance learning for kids. Did they do the same thing in Belgium?
Well, the schools are the last ones. I think I have two children in the age of 14 and 16. So they go to school only 1 day a week. So for them, it will be different. I think what's also strange is that you can no longer shake someone's hand, that you have to keep this distance. If you're want to be an empathic doctor, and in some instances where people are scared, you want to reassure them, and now I have to refrain from that. And even if you welcome someone, you have to welcome them with a nod, maybe a little bit more in the Asian ways of greeting instead of the European. But I think that I'm afraid that will stay, that we have to get used to doing it that way.
Well, I'm suffering because I'm a hugger, and it's my natural inclination when I see someone I know to go up and give them a big hug. And I really have to practice like don't hug. And it's, to me, in some ways, the world was already so cold. And with this new normal, it's going to be worse. And it's just, in some ways, very sad, I think. But but you have to adjust to whatever is going on. You can't set the trends if it's not in compliance with what is serving you and your health and other people. So are you busy now, or you practice very slow?
No, I'm quite busy. Yeah, you immediately sense that when you are allowed to pick up. I think that I'm probably more paranoid with all my precautions than a lot of my patients. There's a lot of we have to we call them. So before they come to their appointment, we call them. We ask them if they have a fever. They ask them if they have been in contact with someone who have a disease or whether they had a disease. We ask them to bring a mask. So we take our precautions. We worked hard with the international organizations that I work with. I'm the secretary of the International Society of Aesthetic Plastic Surgery and the past president of the European Association of Societies of Aesthetic Plastic
Wow, impressive.
Surgery. Well, just names, but I mean, we tried to work together, and we wrote an article. We did a COVID-19 webinar series with ISAPS. We did a COVID-19 webinar with EASAPS. So we try to inform our colleagues, and because, well, now we are ahead. The Brazilians,
Ugh.
they get really hit very hard right now. So they are in the tough corner. The Americans are about to recover, I hope for them. If they continue demonstrating the way they are now, I fear for them, because that can, they can get another hit just because of that. That's not very wise, but well.
Do you think that there's going to be a huge resurgence? I feel like there will be, because if you look in the crowds at the people demonstrating, and I know it's for a good cause, not everyone is wearing a mask, and they are in such close proximity of each other, it almost seems inevitable. Yeah. But I don't get the feeling they're concerned about that. It seems like they're so passionate about their cause that they've thrown caution to the wind.
I think so, and I understand them in that sense. And of course, it's like when we had the AIDS epidemic, everybody thought, well, I'm not gay, it's no problem for me. Mm-hmm. And nevertheless, there were a lot of heterosexuals who got infected because they just thought, well, I'm invulnerable. And right now you see, well, this is a disease that only the older people die of. So, well, I'm young, that won't hit me, I won't die. But as I said, with this Gaussian curve, yes, it's more towards the aged group, but it doesn't mean that there's not hundreds and thousands of also younger people who die from that. So, well, I think it's probably a national or irrational and how do you call that, reflex of young people thinking, well, I will be fine.
Well, the danger in that attitude is that you may be asymptomatic, but you can be contaminating all the older people who you come in contact with. And I think this is why they need to express some form of caution.
Yeah.
Because it's not just about us. Now, I asked this question to a doctor I've interviewed on a previous segment, and he didn't have the answer. I'm going to ask you. You're pretty smart. I bet you have the answer. And the question is, why are some young people dying from this disease and some young people are not? Because this doctor is in South Africa and told me they've lost quite a few younger people and some have recovered. And he didn't quite know why. Do you think you know why?
Well, I cannot give you the scientific answer and pinpoint exactly why, but in general, we know that there is a certain genetic disposition. Some people are just more sensitive to certain viruses and what they attack. A lot of viruses attack our lungs and give us a pneumonia. And we thought for a long time that that was the most important part of COVID-19 as well. But it turns out there are other aspects, such as problems with blood clotting, that are very important. So it looks like that the breathlessness has more to do with the inability to grab oxygen than the fact that you get a pneumonia, which is a side effect and then of course does affect. So what is first and what is second? It's like with you have sickle cell anemia. Well, some people inherit that, and so, well, they're unlucky because they are then more susceptible to that. So I think that in viruses and diseases where there is a particle that's also mutating and changing, then some people are more lucky than others. So that would be my answer. It's not a specific answer, but that is how I look at it.
It makes a lot of sense. I've noticed that around the world, people are participating in these rallies for the Black Lives Matter protests. Have you had people in your country? I didn't see anyone from Belgium on the news, but I saw a lot of people in England and different parts of the world, even some of the Asian countries. Do you know of any such protests in Belgium?
Protest what? About what?
For the Black Lives Matter.
The Black Lives Matter, yeah. Well, we had a huge rally. I mean, and they were way too close. So I think that it was a big controversy because the mayor of the city of Brussels was attacked publicly because he allowed that rally to go on. There have been other cities where they did keep social distancing, but they didn't do that at all in Brussels. So all the epidemiologists and virologists warned us and said that is not a good idea. And I think everybody will agree that Black Lives Matter, and everybody will agree that racism is a really bad thing, that we should try to improve as much as we can. I think there's probably very little sensible people to be found who will not agree with that. But protesting closely together without protection in this COVID era is not a good idea.
I know, I agree with you. I worry about that. What have you learned about yourself during this pandemic?
It's an interesting question, and well, you
The
have time.
I
All
ask
of a
you.
sudden, you have time, so I had some congresses and meetings that I was going to. They were not there. I didn't have patience. So you have some time to contemplate, to ask yourself, do I want to continue my life exactly the same way as I did? Would I want to pick it up again, or do I want to change things? So in that sense, it was worthwhile. You get to spend more time with your family, so you start appreciating them even more than you already did, and realize how important that is. You're kept away from your friends because, well, they have to stay at home, you have to stay at home, so all of a sudden you can do some FaceTime or other contacting on a distance, but it's not really the same. So you start appreciating them. So I would say that are the things that probably a lot of people will have picked up.
I had to ask you that question. I've been asking everyone that question because I feel like our lives are so busy and we're constantly going, and we just kind of kept going with a routine, most of us, and we have vacations, but when we do, we also sort of have a routine for that too, you know. And so I think this pandemic has forced us all into some levels of introspection. So
Yeah.
I was wondering if you had any groundbreaking revelations during that time that you could share with us. What would you do different in your practice now, if anything, after this COVID experience?
Well, that's a good question. Not very much, actually. I think that I like to be someone who takes his time to give explanation and to manage the expectations of my patients as good as I can. Um, and the time that I had to think about all this, I thought, well, actually, I'm on the right track. I think that there's not too much to be changed there. If there's something that needs to be changed, then maybe for myself, I have to maybe not do as many consultations and do a little bit less, spend some more time with my family, and not rush from one meeting to another. Now, all the aesthetic meetings or all the meetings, full stop. I mean, that business,
And
there's
guess what? The world carried on. The world did not stop, right?
yeah.
Because so many people think that, oh, we have to get to these meetings and I got to get on this plane. And I feel like we've been taught that we can still accomplish a lot without all of that craziness.
That's true, but I think that for me, the most important thing about meetings is the networking and the social aspect of seeing each other. You get to learn a lot from presentations you see, but there is the friendship that you have with all these people, and that is now long distance friendship. It's not the same way.
Even if they're next door, it's long distance.
Yeah.
Because you can't go. But, well, I feel that it was hopefully a time where everyone learned something new about themselves and something they can do different that could make someone else's life better as well as their own, and keep safe. Did you lose any friends or family to this pandemic?
Fortunately, I didn't, but my parents are in their 80s, so it's my father's birthday, by the way, today.
Oh, happy birthday, Dad!
He's 4. So I warned them to really keep their distance and to be really very careful because, well, of course, they're in a risk group. Um, my mother-in-law had COVID-19, but was not ill at all. But her boyfriend is still in the hospital, and he had been in ICU, and he's still recovering. So fortunately, nobody has died and has been serious ill other than him. But I know of a Spanish colleague whose father died, whose uncle died, whose husband was in the hospital at a certain point, and another family member was in the hospital. So, as I said during one of my webinars, as long as you know nobody who really got very ill, you tend to think, oh, it's just a flu, and you don't. But if you hear a story like that, he said, if that would happen to me, I would probably think different.
No, I interviewed someone last week in Prague, and he was convinced that this is just another virus that's being overrated. And he was actually, I could pick up his frustration with the quarantine and the economy, because that's what a lot of people are focusing on, is the loss, and the economy taking a nosedive. But one physician in Mexico told me, tell these people, what good will the economy be if they're not around to know the difference?
That's
and, and I had to say that to the gentleman in Prague. I told him, sir, I spend a lot of time every day talking to people around the world, and it's not just a regular virus. Doctors that are treating COVID patients have asked me to tell people to go to work with them, that question the validity or if it's being overrated. So I'm very grateful to you for all the light you shed on this and for spending this time with me. But before I say goodbye to you, which is difficult to do, I must ask you what you want to leave with my viewers.
I didn't catch your question, excuse me.
What would you like to leave with people watching this segment?
I think that what I would like to leave with is that we have to realize that there is uncertainty in our lives. And there's always uncertainty, only we tend to believe that we know how life works. Mm-hmm. And when our lives get shaken up the way they got shaken up right now with this COVID crisis, I think we have to appreciate life much more and what we do with it and what we do in it. And I'm a firm believer that integrity is extremely important. We have to be honest and straightforward to each other and tell what we really feel is the truth. So that's why probably I'm not so much a fan of complot theories. I believe in a servant mentality, is that we try to reach out to each other and that we try to help each other as much as we can. And if there's one thing that we can learn from this COVID crisis, it is that a lot of people all of a sudden were ready to help, and people were much more friendly with each other. And it would really be nice if we can hold on to that feeling for the years to come.
Thank you. I love that. And I'm a lot like you. I choose to see the good in mankind. But, there is dark and there is light. There are good people and there are people who put as much energy into doing bad and wrong that you and I put into doing good and making the world a better place. And unfortunately, that's a reality that you and I cannot change. We can only try to outshine dark with our light. And so stay the way you are. I love it. I think that life is short. And why not leave a legacy of good in the world?
Totally agree.
Thank you so very much for your time and for sharing your expertise with us. And thank you for watching Conversations with Jennylyn. When a conversation is all you need to be inspired, like the inspiration I'm sure you will gather from this conversation. And I will see you next.